Welcome to today's webinar presented by Supercoder.com. Supercoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
Pre- and post-payment audits, along with many other things, is this concept of medical necessity. And medical necessity, is sort of before we get anything done. It's that sort of fairy tale, some doctors think, as we get at the very beginning of what we are going to do in providing care for the patient. AMA has a definition. Medicare has their own definition. But the bottom line, medical necessity is generally, from a policy process, is determined by the carrier, whether it's Medicare or someone else. And so you have to know what the medical necessity is for a given procedure or code based on what that particular carrier says. So medical necessity is something we always have to remember. We do it for a reason. As we see on slide number 4, that the Internet-only manual for Medicare says that medical necessity is the overarching reason, the criteria for payment, and that if we don't have medical necessity, they're not going to consider payment. And they also say just because you have lots and lots of stuff written down or dictated or typed in, that a volume of documentation does not mean that you should have a level of care or even a higher level of care because you have lots of documentation. Blue Cross Blue Shield gives us information on a lot of our carriers that say, we need to establish medical necessity before you perform the service. So telling us it's an upfront thing that they want to see. So when it comes to medical necessity, don't assume anything. Just because there's a treating provider that orders and prescribes and directs the care of the patient, that the health care service is considered medically necessary by any given carrier. We want to give information to our carrier in the documentation, but we want to give them the most detailed information, and that translates into specificity in our coding when we're looking at diagnostic coding. So Medicare's definition of medical necessity is on slide number 6. There's a reference on where you can find that, and there is actually a glossary of terms that's on the CMS website that you can go back and look at exactly this definition. And we're used to seeing that are properly needed for the diagnosis or treatment of a medical condition, that are provided for the diagnosis, direct care, and treatment of a medical condition. We don't usually meet the standards of good medical practice in a local area, because that's certainly something that could be challenged. But we also do frequently see aren't mainly for the convenience of the patient or doctor. And we're going to look at some instances of why would you postpone something if it wasn't needed to postpone it, other than that you wouldn't get paid if you did something on the same day as you did another code, that they're inherently bundled together. And that's what they talk about when they say it's not just for the convenience, or I could maybe insert payment, if you will. We're going to look at, there are times that we can do two services together appropriately and attach modifiers, but the bottom line is the dictation, the note, whatever it is that we have for documentation, really needs to tell the carrier a story about why are you doing to the patient what you're doing. Whether it's in an evaluation and management code, whether it's in a procedure code, it's sort of the why. Why are we seeing this patient? Why are we doing something to the patient? And doctors and our providers are notoriously brief because of their trying to do as much as they possibly can. And what I'm seeing in audits, post-payment and pre-payment audits, is I can kind of get a sense that the patient was really sick, but they don't say the patient was really sick.
Supercoder is the fastest-growing online reference tool with more than 25,000 subscribers. Call 866-228-9252 to get a free product demo, or sign up at supercoder.com for a 7-day free trial.